Subscribe to our YouTube channel and hit the bell icon so you never miss a video from Radio 1.
Welcome right back. Thank you so much for joining us on Going Mental. And World Suicide Prevention Day is today, 10th of September. It brings to light a shocking stat. Every 40 seconds, a person dies by suicide in the world today. So, you know, people at their prime, Bollywood star Sushant Singh Rajput, international DJ Avicii, to name a few over the last, couple of years. I have to get to the bottom of it, Doctor. I mean, what really drives one to such a decision, such a radical decision to take one's own life?
Very good question, because, every day all of us are doing something or the other to preserve our lives, the exercise and taking care of your body, taking care of your mind. We're doing what we can to have a good life. To think that we can ourselves take our life is quite surprising. So your question is about the motivations, and we have a lot of psychological theories that have been proposed along the way, but suicide is not a new concept. But our theories and why we do it changes because we try to understand the human mind more and more. So we have what we call the internal motivation and the external motivation. So in internal, we talk more of this term called psych-ache, which means just like you have a stomach ache, headache, body ache. We talk of psych-ache, which is intense emotional pain. It's something that gets beyond your bearing capacity, that you want to end your life simply to end the pain. So that also brings us as an extension to the escape theory, that we're escaping the pain. That's another theory put forward by another theorist. And these are more internal. When we have a lack of problem solving, that means we have a problem, we can't solve it, we want to escape.
Okay.
Simple. It just seems so logical to the person that this is not resolvable, so let's just end it. And
Wow.
that brings us to the concept of the future not getting better, which is hopelessness. Helplessness is my inability to deal with my current situation. Worthlessness, we use these three words very commonly with depression: helplessness, hopelessness, worthlessness. It's the triad of depression. Helplessness is my present situation that I cannot deal with. Worthlessness is that I am incapable as a person. I have very low self worth. But with helplessness and worthlessness, you can still survive if you have hope.
Right.
Once hope is gone, what are you going to bank on? So, hopelessness theory of suicide has always been very prevalent. And a very important factor, we could actually be helpless, hopeless, worthless, and still not commit suicide if we can think it through. So the very
Right.
important thing that comes in is impulsivity. So a
Mm-hmm.
lot of suicides are impulsive. A lot of times it's the escape mentality, that I want to escape the pain. I don't want to die. I have gotten messages from my patients. Doc, I am standing on the 17th floor of my building. I'm not going to jump, but what if I slip? You want to stand there to have someone else sense the gravity of what
Mm.
you're feeling.
Right.
And it
Right.
the relationships you have when you do cognitive therapy, you're so involved with your patient that you get a message like that. It is a cry for attention, but it is impulsive to stand on the ledge of the 17th floor in Bombay City. You could actually slip. So impulsivity is a very strong component which leads to a lot of suicides. And then coming to the external theory, where we talk of interpersonal bonds. Interpersonal bonds are like, uh, things that just hold you together. And if you're together, you're not alone. And
Mm-hmm.
if you're not alone, you will not die, because you're
Right.
not having 10 people die with you, right?
Right.
Uh, the concept of suicide pact is different. But what we're talking here is when you are connected, you're not isolated. And when you're not isolated, chances of ending your life are very limited,
Yeah.
because you're connected to the world.
So it brings to light the importance of society, right? In helping each other, whether it be in a family unit or in an extended community. It's important for us to look out for each other and try and figure the signs, and to know when someone's in deep despair. Uh, you know, give us some tips, or give us some kind of guidance as to what we need to look out for.
That is a very good question, because all the examples that you mentioned, I mean, talk of Robin Williams too, talk of so many people who
Hmm.
make the world laugh, who raise the spirits of the rest of the world. And suddenly you see that they take their own life. So you would question, best of us cannot see it coming. Sometimes they hide it so well that no one's able to see it. But subtle signs, which are kind of more obvious, would be someone seeming withdrawn. It's more like a change in behavior. Suddenly somebody seeming a little more withdrawn, a little more isolated, not connecting. And contrary to what the world believes, that those who say it don't do it, those who want to do it will just do it nonetheless. But
Hmm.
no, they always say it. They
Right.
say it as a joke, they say it in passing. They just, nobody, you and me, you and I, we don't just talk of suicide just like that. I mean, I may sometimes say life is hard. I may actually say life is hell. But I've
Yeah.
never said life is not worth living. I want to end this. So
Hmm.
that myth that those who talk of suicide don't do it and those who do it haven't spoken about it, occasionally at some point they would have spoken about it. They would have expressed that things are not okay, this is too hard, I can't deal with this, and you just take it in passing that everybody's got issues and everybody's got stressors, and we dismiss it. The
Right.
moment you dismiss a suicidal person's idea, they're trying to give you a subtle hint, that hey, I need help, and you say, hey, no, it's okay, I go through more than you do. That
Ah.
just dismisses it completely, and we have taken away the helping hand. The person is underwater and they're actually putting the hand out
Right.
asking for help. We've just said, hey, you know what, deal with your problems, because they're not really problems. So dismissal is what drives people a lot to actually commit suicide, because that actually angers them.
Right.
Suicide is not only sadness, it's a lot of anger too.
Right. So then some tips to help us build like, our zest for life, our drive for life. What is it that we can change around in our head and our mindsets so that we can, make it worth living?
Mm. As you said, make it worth living. Actually, it's always worth living, but we have to see it that way. That's where the cognitive model of suicide comes in. 'Cause I practice a lot of cognitive therapy by Aaron Beck. So essentially, the cognitive model says that we see things as meaningless, we see things as purposeless, we see ourselves as worthless. People who are suicidal say, I'm good for nothing, I make a difference to no one. But I tell people that I don't even know you. I don't know your family. I don't know people around you, but I bet there are two or three or five people in the world who actually care about you. So even when you think, I think it's such a distorted vision of reality that
Hmm.
you don't realize what is real and what is not. Like you may say, no one cares about me, though there are plenty who care. You may say, I'm not good for anything, though you are good at a lot of things. It's just insanely impossible to be good for nothing. So I think in order to help someone who feels that way, I think firstly, of course, even as human beings, you don't have to be a cognitive therapist or a psychiatrist or a counselor for that matter. You have to be a sensitive human being to pick on these signs. And even if someone mentions it to you in passing, don't dismiss it.
Right.
So always try to question. A distorted vision, anything that's distorted is only going to get untwisted if someone has help in untwisting it. So
Hmm.
if someone has a distorted version of their reality, I think you have to help. We have to help them untwist it. That's what I do as a professional, right? And
Right.
we do it as human beings, because when we see somebody losing that zest, we've got to find a way to correct their distorted vision of, like I said, if you say interpersonal theory and they say they don't have social connections, but there is always somebody. It cannot
Hmm.
be nobody. So
Right.
more than you, of course, help them to build connections, try to talk to the people more, feel connected, because the more they connect with you, they will not be disconnected and isolated. But more than anything, I would say, if you have a good rapport, good enough rapport, request them to seek professional help,
Hmm.
but be there for them. Be there to
Yep.
change that vision that you are not as helpless or worthless or hopeless as you're envisioning yourself. And even a slight ray of hope, even a tiny twig, people do hold on to. And then gradually you can pull onto the twig and get to the branch and sit on the tree and, be strong enough. But I think we just have to be sensitive and empathic towards somebody. It's not just like suicide comes from deep and long-standing depression, which is
Hmm.
then clubbed impulsivity. You see, there's a difference
Yep.
between ideation to action.
Right.
So when you see somebody feeling low, don't dismiss their feelings. Don't say that this is nothing. Everybody goes through it. Everybody goes through it. I won't deny that. But everybody's coping capacities are different. So
Hmm.
some of us are more endowed and more empowered, and some of us are not. So
Right.
I think we can be sensitive enough to people who are not so strong to deal with it, and we can empower them and make them strong. It's just like
Right.
you go for a workout to the gym, you just go for a mental workout to a therapist. It's something as simple as that.
Right. Countries spend less than 2% of their health budgets on mental health. It is expected that in the next 10 years, depression will put more burden on nations than any other disease. So, how do we go about addressing this at a community level and also at a national level? How can we start to heal?
Erica, you mentioned community level and national level, but everything eventually starts at an individual level, right? At even communities and nations and leaders of nations, we need to enhance the sensitivity there first at a personal level, right? I mean, I'd like to bring this point forward actually as a psychiatrist. I mean, I'm a doctor, but fellow doctors do not realize the importance of mental health. Even people from other specialties don't realize, and especially doctors undergoing depression themselves. So to
Right.
think that this medical illness, which warrants medical attention, but doctors are the ones who actually won't seek it. So this self stigma that we have internalized, I talk of community stigma separately because we believe that the world stigmatizes us for our depression, but we stigmatize ourselves a lot more. So I think we have to fight the battle. The biggest demon is with self stigma. When we realize that talking about depression is a good thing, I actually have patients today say, Doc, can I tell my boss about my depression? People actually are wanting to talk about it so that they can advocate for others too. People who see me, I tell them, y'all are luckier than most because you're actually seeing me and getting help. There are so many who don't.
Hmm.
So I think when we talk of the global burden of illness, yes, the World Health Organization has mentioned that depression is going to soon be the leading cause of disability worldwide. It's because we think that disability is not breaking a hand or a leg. That puts you on bed for 2 months where you don't work, or even if you're an Olympics athlete, you'll be like 5 months before you get on your feet again. But something like depression could go on for years, for decades together, handicapping you, disabling you from taking care of your health, disabling you from having a good job, a family life, the love that you deserve, relationships. So the disability that poses and the cost of that, a non-depressed person would work so much better and would be so much better even for your per capita income,
Hmm.
but we don't realize that, so we don't pay heed to psychological illnesses as much as we do to physical. When you go to a corporate at a larger level, people will talk of controlling hypertension, and they will talk of stroke, and they'll talk of all the, but they don't realize that it is stress induced problems which are leading to increased heart attacks and strokes. So I think we need at a larger level, if we can spread awareness, to say let's talk about this. So we have some of our Bollywood stars, we have so much of Hollywood talking about it to raise that awareness. Transiently, I think we wake up, but
Yeah.
the way a movie comes and goes, and the noise around the movie is gone, I think even the importance that we give to these issues that are raised by people. So I think it has to be a consistent and ongoing effort
Right.
to really make psychological wellness part of schools, part of corporates, everywhere. I work for a lot of corporates in the field of mental health, and we're just doing so much of awareness about how emotionally healthy are you,
Hmm.
because it's about being, we have five diagnoses in mental health: anxiety and depression and schizophrenia, and pretty much that's it. But that's not it. We have a whole spectrum between the zone of wellness and illness. So don't focus on the illness. Don't focus on the name, depression or anxiety. Focus on how well you are. How
Yeah.
well are you functioning? And so, if larger groups at a school level, at a corporate level, and then as we go on, if we talk about nations, we talk about more awareness drives. We have to have billboards not of politicians and Bollywood. We need more of emotional wellness. You could just have a question: did you sleep 8 hours last night? And if you didn't, then there is something not okay. there is something that could be pointing towards a depression or an anxiety or any other problem, and it's worthy of your attention. I think we
Right.
just need people more aware of these things.
Yeah.
We need more awareness and break the stigma. You break the stigma, I think the job is half done. Then everyone's going to be talking about it.
Right.
You have at a dinner table, someone stands up and says, "Hey, I have an endoscopy tomorrow, and guys, I won't be seeing you for a couple of days, but you guys are free to come and see me." But the other person doesn't stand up and say, "Hey, I have a psychiatrist appointment tomorrow, and I'm really depressed, and I really need your support." We don't do
Right.
that.
Right. Right. Yep. Here's my next topic. Mental health cannot be tackled in a silo because it is not just a health sector issue. Its impact kind of percolates all the way through our entire society, including our country's economy. But let's bring it to our kids. How do we include mental wellness in our schools going forward as children now, going back to school, schools opening up hopefully in the not so distant future? How do we ensure that mental wellness is taken care of in our schools?
Sure, that's a very good point because children are our future. So I think it's most important, and I think kids have been impacted to a very maximal extent too through the lockdown, because we as adults have already been through our phase of social development, but kids are only evolving into it. So their friendships and communication with people of their own age, once that has been restricted, virtual communication is just not good enough. So kids have been feeling that sense of isolation, and social skill building has definitely faced a deficit. So I think schools in general are quite cognizant of the needs of kids. I see a whole range of teenagers, especially that whole tween and teen period is very sensitive because kids are in a transition of moving from childhood to adulthood. So I think helping them connect, building on interpersonal communication, having more of cooperative. Yes, we still have to be safe, but we need a lot more of cooperative and interpersonal activities to help kids bring back what they've missed, and at the same time still be safe. I think we're just living in an all new reality today. So something that just seems like a reality show, but this reality show has become life.
Mhm.
So I think we need to have a little more of, as we call positive psychology or pop psychology or pep talks, as we call it, for kids. And just talking to them to help them realize that if you have a problem, you should just talk about it. And there is somebody to listen, and there's somebody who's not going to judge you. That is one thing that kids always worry about, because they just grow up in the thing that we have to keep our parents happy and we've got to keep adults happy. So we should not talk about what we feel. So I
Mhm.
think, irrespective of the pandemic, childhood depression, childhood anxiety, especially the pubertal age, there's just so much going on, right? With the hormonal changes in your body, the changes in formulation of an identity. There is just so much of gender identity confusion these days. So we need to address that too. We
Yeah.
need to remove the taboo from so much,
Mhm.
especially because things are getting formed at this time, right? It's wet clay. So this is the best time to mold it rightly to prevent it from becoming hard, because once it's gotten hard, then unfortunately we stand the chance of breaking. But while we can mold our kids rightly, I think we should have a little more of pop psychology talks for them. You should
Mhm.
have dynamic educators and therapists and counselors involved with schools, so that we can address specific issues which come up at specific ages. Like, as a developmental consultant, I've studied so much of what happens to kids at what age.
Yeah.
When the age when we have an aversion to the opposite gender to when we start developing an interest, for example, or when gender identity gets developed and when it could get disrupted, and any parental conflict, what sort of impact that has on kids. This conflict has actually gone up in relationships a lot because through the lockdown, parents have been with each other, so there have been more of arguments and things like that, which children have been privy to. So I think we just need to address all of this, educate teachers, educate parents, and spread that wellness. Like, if wellness could spread like wildfire, the world would be such a better place.
Okay, so here's the thing. According to the WHO, every $1 invested in mental health yields a $4 return on investment. So, doesn't it make sense to the bottom line? And why aren't companies then investing in the mental health of their employees as much as they should?
Very good question. It's a question I ask corporates all the time, Erica, because I work in corporate wellness, right? And I am engaged with a few companies right now. But unfortunately, I've had HR professionals tell me straight away on my face that, like, I won't name the company, somewhere in South India, I won't name where, but we had a full talk about a program on stress management, like a 2-day workshop. I said we'd incorporate diet and yoga, and we do live sessions, and we make it interactive, and we do a whole 2-day rejuvenate your mind body. So she said that sounds really amazing, but you know what, we'd rather keep our budgets for some training that would guide our engineers to be better, because that would enhance our like, they think that all we need is numbers, but then they don't
Output.
realize
Yeah.
that they don't realize that output will multiply manyfold when you have de-stressed employees and not distressed employees. But unfortunately, they don't understand that after a detailed explanation, to and fro proposals and emails, and we love your program, it sounds amazing, but we don't want to pay for it. So
God.
that's where they realize the importance. I wouldn't say they don't realize it. We've actually had leading HR professionals ask us, why should we have someone like you on board? We could just Google it. We could just Google and read about stress. I said, yes, there's a lot of information out there, but talking to somebody who can guide you rightly on how to change your life, not just we can talk to you for 2 days, but we can guide you forever. But no, they're not willing for that. So I think again, it's more of that awareness and realizing the value, because there's just something very wrong with the numbers here, that
Hmm.
they're not realizing what this is going to do to their output. And so while they realize the importance of it, they don't give it enough credit. We call it grades of insight, that I know this is important. This is like an alcoholic who says, I know the alcohol is going to hurt my liver, but I can't control drinking. So it's a very bad state to be in, that intellectually, we call it intellectual insight. You know this is good. You know it's going to help you. But at the emotional level, I'd rather spend money somewhere else, and I don't want to have my employees take a break for a program like this. That's 5 hours of their time.
Yeah.
You know, we
I
do
think,
workshops.
yeah, I just have to say, I think instead of, you have a CFO, right? You have a CEO, you have a CFO. You either need, I think you need a CWO, or like a chief wellness officer, or a chief, yeah, you should.
And we do have a lot of these, but it's just not enough. We just need a lot more acceptance of mental health. I don't even think it's a stigma anymore, because we're talking preventive health. We're talking of why you should sleep better, and if you sleep well, you won't be depressed, or
Mhm.
why taking that 15-minute break in a day and just talking to a friend can actually be a stress buster. But we don't realize that, no, 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 we should work. We should just work more and
Yeah.
more. And we don't entertainment on site, because then people will be more interested in table tennis and
Yeah.
not in working.
Yeah,
So
I do that. I take breaks throughout my working day, either connecting with people, or going out for a quick walk, or doing something, because it just immediately changes your whole frame of reference, changes your mindset, and you come back sometimes even more energized to get on with the work and finish it off at a faster pace.
people don't realize that this
Yeah.
little break rejuvenate me for so much more.
Absolutely. And corporates, please, all of you should have sleep rooms whenever the people come back into work. Please have your nap rooms. Most important. That's what I believe.
As then you just get into a pod yourself in and sleep.
Yes, absolutely. Here's my next question to you. Now, there is no health without mental health. I love that saying, which brings me to this. Do insurance companies in our country cover mental illnesses adequately?
Erica, very good question. Adequately, I don't think they cover it at all, because they believe that mental illness is a matter of choice. You drink because you have bad habits, and you're just sad because you don't know how to cope. And uh, mental illness doesn't get the respect that it deserves, and it's simply because people are not aware of the damage that mental illness can do. I feel, in fact, if you invest in mental wellness and have a lot of people, by the way, don't take mental health treatment simply because it's not covered by insurance and it's too costly.
Mhm.
And And I always want to ask them that if you think mental wellness is costly, try mental illness. It
Yeah.
costs you way more, but people don't realize that. So I think more than anything, yes, we're talking insurance companies, but at an individual level, you see, the insurance providers too are individuals who are not seeing value in this.
Mhm.
They would actually save so much if they offered preventive mental wellness services, and people who are psychologically healthy actually take care of their physical health way more. So when you invest in psychological health, you're already minimizing smoking, drinking, alcoholic liver diseases, a lot of irritable bowel syndrome, the whole gastrointestinal, like all the GI experts would know how much mental health leads for patients coming to them. Talk about orthopedic surgeons seeing stress related backaches and neck aches, that's 50% of their practice, which would all go down if we invested more in mental health. Talk about pulmonologists, all the bronchitis and asthma, which is because of smoking,
Mhm.
that would go, and the cardiac issues, less of stress, so less of heart attacks, less of hypertension, and every aspect of health would be so much better if you invested in mental health. So I think insurance providers really need to see value in this, because somewhere they're getting their maths really wrong, that they're spending, willing to spend for physical illnesses, not realizing that if you spend here, you will be avoiding all those other illnesses and you'll be saving a lot more.
All right. Well, thank you so much for your insight as always and joining us. And we shall connect with you real soon. Thank you.
Erica.
Subscribe to our YouTube channel and hit the bell icon so you never miss a video from Radio 1.